If you suffer with fibromyalgia, you suffer from a lot of fluctuating symptoms: pain, stiffness, anxiety, depression. Being active is very difficult when you're experiencing that. However, if you try to do a little bit every day and maybe several bouts of a little bit each day, you will feel better when you exercise with fibromyalgia. It's very important to work on mobility, resistance training, and cardiovascular exercise. So with your cardiovascular exercise, you want to start with 5 to 10 minutes. If that's what you can do, that's what you do. If you are experiencing any type of a flare, you're going to treat this similar to someone with rheumatoid arthritis, and you want to make sure that you are exercising in a safe way, doing what you can. So you may want to go back to a mobility exercise or a body weight exercise rather than lifting weights or doing some type of heavy cardio. With fibromyalgia, you want to do light to moderate cardiovascular exercise. You want to start with something you enjoy, something that you know you will be consistent with. Again, you want 5 to 10 minutes, building up to 30 minutes a day, depending on what you can do. If not, try a mobility exercise routine, whether it be one that I've done or someone else's. Try a mobility exercise routine and just do what you can on that day. As far as resistance training, you want 2 to 3 days of resistance training. The stronger you are in the building of that connective tissue is going to do nothing but help your fibromyalgia. So you want to start with low repetitions. 4 to 5 repetitions is enough. 2 to 3 sets. Assess between each set and see how you feel. 4 to 5 repetitions of each exercise, building up to muscle endurance type, which would be anywhere from 12 to 20. Lower weights, so you want this to be light to moderate. We're not interested in going heavy starting off, and then you'll build from there. Flexibility, you definitely want to work on flexibility twice a week. So think of this: cardiovascular, you want to do most days of the week. You want to do your strength training or resistance training 2 days a week. And then you want to do your mobility 2 days a week. Also think about looking at some of the modifications that you would for rheumatoid arthritis or other types of arthritis. And wherever you're having those pains for that day, focus on working through that. Focus on getting your cardiovascular and your resistance training. Sometimes you can consider combining the two. Sometimes this works really well for people with fibromyalgia because they may not have the energy to do 2 different programs or changing it up and spending so much time exercising. So you may want to combine the two, do a little strength and do a little cardio as well. That works. Just keep moving. So let's also talk about some other types of things that you can do, physical activities that you can and should do with fibromyalgia. If resistance training is not working for you, you're not feeling it, and you want to continue moving, but you need to find another avenue, consider doing yoga, Tai Chi, dance. So any type of Zumba or any kind of movement dance therapy that you can do will be good for fibromyalgia. Also, if you are considering strength training, try alternating. So I'm going to be doing a program that has alternating legs to an upper body, legs to an upper body. Specifically for this, doing 5 repetitions for each exercise. And that way you're giving that connective tissue and that muscle some time to rest before you move on to an exercise for that same body part. Hope this helps. Have a good day.